Welcome back to Life and Living. I'm joined in the studio now by Professor Denise Vill'Neuve, who is the Chairperson of Allied Health at the County College of Morris. You're also the Program Director for the Radiography program at the County College of Morris.
Correct.
Welcome to the show.
Thank you.
What is radiography?
Radiography is the study of taking x-rays. It is a profession in the radiology department. Our students come in not knowing anything, and they walk out after 2 years of the professional phase of the program, and they are a radiologic technologist, and they're able to take your x-ray.
Are you tough on them?
Very tough. I've run a very strict program.
Why?
Because I'm preparing them to be a professional, and I want them to be, and 2 years ago, one of my graduating classes, one of the speakers at one of the graduates said that I am the toughest professional they have ever met. And I taught them to be good professionals.
You proud of that?
I'm very proud of it.
That doesn't happen by accident in your world?
No. It's very important that we take care of our patients. It's very important that we give our patients compassion and time, which sometimes we can't give them always in the hospital, and you have to be a professional. This is not like, and I don't take this away from any other profession, but it's dealing with patients, sick patients. There's
a lot of stress, right? The workload is high.
Very high in today's world.
And in our emergency rooms, we see just an influx of people who are using this as their primary care.
Correct.
And so you've got to manage the workload, you have to manage the stress, but you have to have that element of compassion.
Right.
How do you balance that? And how do you teach that?
I think with our students do 1,600 hours in clinical alone and 1,100 hours on campus. The 1,600 hours in clinical, I think, if they don't come in with it, but I believe most of our students do come in with some type of compassion. If they don't come in with it, they learn it within the 2 years. It's funny because you see students come into the program that know nothing, don't know what an x-ray tube is, don't know what a bucky tray is, and in 2 years they're walking out and they could get a job the next day once they take their boards. And they're ready.
Is there growth? Is there demand in this field?
There is growth, not as the job opportunities are not as great as they were, but my graduates from the class of 2013 are still getting jobs.
So let's talk about radiography and what it does and how it helps. What are some of the ailments, what are the diseases that we're preventing, that we're treating through radiography? Well,
in the field of radiography, I mean, it's a very, very technical field. And in today's world, the patients are coming in for all kinds of things,
like
from
what?
A simple chest x-ray, okay, to see, if you're going into the hospital for surgery, everybody has a chest x-ray in today's world, okay? If you're having, now we have the flu going around. Patients come in, they do a chest x-ray to see if they have pneumonia. Maybe the flu has led to pneumonia. Then we have CAT scan, MRI, ultrasound. Those are all secondary professions, but they are also to see patients that have cancer.
Ultrasound if you're expecting.
Expecting a baby. MRI if you have a really bad back. You know, it leads to, it's a very technical field. Years ago, doctors diagnosed with what they had. We didn't have CAT scan. CAT scan, MRI, ultrasound came in the late 70s.
It's still new technology, relatively new technology.
Right.
It's interesting you say the way things used to be, and you have a very interesting background. You started working in hospitals, in urban hospitals.
Right.
What did you see, and is that part of what made you so tough?
No, I think it's my personality that makes me tough.
She's going to be tough no matter what.
No, but I mean, I got into the field in I graduated high school in 1974, graduated from Bergen Community College in 76, working at St. Joe's right across the street here, and for 5 or 6 years. And I come from a middle class family, and you come here to an urban hospital, and you have to have great compassion for these people.
Is it true there was no medical examiner, and so you were doing the scans on dead bodies? It's true, though.
It is true. Back then, there was something, and I don't know the political aspect of it, but there was something with the Passaic County Medical Examiner's office at the time, and myself and my coworker Bill, we used to take, they would bring the bodies in, and they asked for volunteers, and Bill and I always volunteered.
Because you're tough, because you are tough, because you've always been tough. So how are you preparing your students to get out there and market themselves in this field?
Well, I tell them that they're on a 2-year job interview because we go to the clinical sites from the very first semester they're in the program.
So they're hands-on, right there on the ground learning.
Right, and they're also being watched by the employees. 80% of my graduates from when we started the program work in our clinical affiliates, our 6 clinical affiliates. So they're being hired by our clinical affiliates. We also have 14 graduates that work for hospitals of special surgery in New York City. And we just had one hired last week.
What do you love about your job?
I love to see the students start out not knowing anything, and in 2 years, they're a working technologist.
And is there something about seeing the people who you've helped and seeing how radiography impacts and changes lives, seeing people who are sick get better? I mean,
well, I like to see, as far as the students aspect, it seems like all the patients always say how nice the students look, because they have a strict uniform they have to
so
wear.
Presentation is important too.
Yes, right, and the patients always compliment our students on how they look.
You run a tight ship, it's
Right.
intentional, and it's no doubt changing people's lives, not just the patients, the students who are going to go on and touch even more lives. Professor Denise Vill'Neuve, Chairperson of Allied Health at the County College of Morris. You guys are always doing great things, and we are continually learning and growing by meeting people like you. Thank you so much.
Thank you.
Great.
That's it.